afternoon. My name is Diego Ortiz, and I'm excited to welcome you to this special conversation hosted by the American Heart Association on Long Island and presented by our Live Fierce Go Red sponsor, Northwell Health. It's now my pleasure to welcome two distinguished guests from Northwell Health, Dr. Stacey Rosen and registered dietitian Marissa Licata, who, along with Jennifer Mirez, Dr. Mirez, and Lori Russo, are co-authors of a new book about women's heart health titled Heart Smarter for Women, 6 Weeks to a Healthier Heart. Let's welcome Dr. Rosen and Marissa now.
Thanks for having us here.
Thank you. Happy to join you.
You know, it's my pleasure, and I want to congratulate you on the success of your book. And for the purposes of this conversation, as we're talking about a summer of health and really borrowing your framework of 6 weeks to a healthier heart, I thought it would be great for us to go over 6 kind of like hot fire topics to get us heart healthy. So how does that sound?
Perfect.
Sounds good to me.
Okay, excellent. So let's get into it. So in your book, you kind of break it down week by week. In the first week, it's really about stocking your kitchen. So let me ask you, Dr. Rosen, why is it important to have a heart healthy shopping list and have healthy snacks at home?
Thanks, Diego. That's a great question. So, first a reminder, as the HA teaches us, and as we know well at Northwell, that most of our risk for heart disease is preventable, and we can make the right choices. And the theme of Heart Smarter is optimistic and uplifting, because there's so many things that are hard to do, but we want to make this easy. So the importance of a heart healthy shopping list can't be underestimated. First, it empowers each of us. It's in our control, something we can do positively. It is a tool, and Marissa has taught me so many, and there are others, who support the toolkit that each of us can use to feel better about making heart healthy decisions. We know that when you go to the supermarket with a shopping list, meal planning is made easy. You save time, money, you're more likely to choose wisely, not waste food, and it's easier to avoid impulse buying. Oh, look at that, it's on sale. I know it's not a good choice, but I should do it anyway. So that shopping list is one empowering tool that can really have a big impact on the food that sits in your pantry and in your refrigerator.
Well, I love that. I mean, I know that I'm guilty of going to the supermarket, and especially when I'm hungry, getting a few things that maybe aren't the best thing for me. And when I'm home, when I buy those unhealthy snacks, when they're in the pantry, I reach for them in the evening after work. So having that heart healthy shopping list is probably a good way to avoid both of those temptations. Marissa, in the book, you talk about what I love, purging the pantry. So tell us what that means and how do we do it?
Sure. So really, our home is where all of our majority of our food that we're eating is. And so we really have to look in the pantry, look in the refrigerators, look in our freezers and see, what are we stockpiling? What do we have in there? And what are our go-to items? And you want to look for the foods that we specifically mention in the book that are excessive in salt, excessive in fat or sugar, highly processed items, and just get rid of them. Because if they're there, they're yours. Eventually you will eat them. So the tip is really to get rid of them and then go back to that healthy shopping list and stock your home with the right foods, the healthy foods that are going to support your new heart healthy lifestyle.
And from moving from week 1 to week 2. So now that we have the right ingredients in the refrigerator and in the pantry, and we're fueling our bodies in a way that's heart healthy, then we move, well, you move in your book to movement and moving more every day. So Dr. Rosen, why is it important to choose movement every day? And really, is it even a choice?
No, absolutely, Diego. And the beauty of movement is that it's not an all or none phenomena. So many people are challenged by the heart healthy choices that if I don't do it perfectly, particularly women, then I can't do it at all. But we've learned that increasing movement in any way has a positive impact. I like to joke that the word exercise is a curse word in my practice because it makes everybody think they need expensive clothing or great, expensive sneakers or gym membership. We know that any amount of moving, particularly walking, can improve blood pressure, can improve your mood, improve your ability to sleep, help with bone strength for women, which is so important. And again, 10 minutes here or there, a couple of things that you do every day with consistency have an enormous impact over a lifetime.
I've always been a fan of that approach of taking those incremental steps and having them add up over time and really getting that payoff by investing a little bit throughout the course of a week, a lifetime, and it adds up. Something that I feel like we often overlook is the importance of keeping ourselves hydrated. And we might be tempted to maybe make some choices around energy drinks that maybe aren't healthy. So Marissa, as a registered dietitian, what is the benefit of water and what should we look out for in energy drinks?
So thank you, Diego. That's a really important comment you just make is hydration. I'll start with that. So many of us do not hydrate adequately enough. And for some of us, it's very hard to get the distinction in our bodies between, am I hungry or am I thirsty? So we really want you to stay adequately hydrated throughout the day. Get yourself a specific cup that's just yours, that you know you're going to drink well out of, whether it's a straw or a bottle. And really, water is the preferred hydration source. Have it ice cold if you need. You could put some flavor slices in it with lemon, lime, different flavors, strawberry, just to really get you to drink it as much as you possibly can. Now, there are certainly time and place for some of these sports drinks that are on the market in the hot summer months, especially if you're exercising or outside for prolonged periods of time. You could gravitate towards some of those, but they have their time in place. We don't want you to consume those regularly. And what you really want to look out for are the ingredients in some of these products that are on the supermarket shelf. And we talk about reading ingredients lists, even for beverages. And you want to look out for how much sugar is in some of these products, how much or which even artificial sweeteners or sugar alcohols could be in some of these products. Are you sensitive? Do you get GI upset from certain sugar alcohols? So you really want to be mindful of what you're picking up in the bottle and what's in them and how you feel afterwards. And tried and true is water. We really want you to drink as much water and get yourself adequately hydrated. Again, and particularly more, the summer's coming and the hot months, to make sure that you are drinking enough fluids.
I love that you mentioned that, especially in the summer months and the hot months. Okay, so we've made it past week 2. We've cleaned out our pantry. We're starting to incorporate movement into every day. But now we're going to go back in week 3 and level up. We're going to eat smart for a healthier heart. So Dr. Rosen, what does eating to live, not living to eat mean? It's something that I read in the book and it kind of stayed with me. So can you elaborate on that a little bit?
No, absolutely. Thanks. The same way I've taken the word exercise out of my exam room, I never use the word diet. It sounds artificial, and we want to live making healthier food choices. So when I think about how we eat, I think about the whole approach to mindfulness, and mindful eating is important. It means being thoughtful about your eating choices, your enjoyment of the meal. And we speak about sitting down when you eat, unplugging from devices and concerns, sipping, tasting the food you eat, so that every part of the experience of enjoying food is something that you're doing with true commitment to the moment. It means picking your food choices when you're preparing, enjoying the preparation, and really not just, shoving food in as you're driving or taking a Zoom meeting, but enjoying the act of eating food and being proud of yourself as you choose wisely, enjoy the taste of the food, savor it a lot.
No, I appreciate that, because I think it's so tempting again to be on the go, to, especially when, we're talking about fast food culture or our busy day to day, to just kind of mindlessly eat. But to eat mindfully also allows us to practice gratitude while we eat, and to really be aware of, like you said, the taste, the texture, what we're putting into our bodies. And I'm a believer, especially when I'm in New York City, that you walk fast, but then you eat slow. So you get to the destination and then you take your time when it's time to eat. So maybe that'll catch on.
I like it. And even, I've started using placemats and a prettier plate and a better napkin, something so that the whole enjoyment of a meal and the food is really something to savor and be grateful for, as opposed to just, mindlessly fueling.
Sometimes it's almost like aspirational to eat healthy at every meal, because there's times, like we said, we're in a rush. But is it possible to eat healthy at every meal?
Excellent question, Diego. I really do think it's possible to eat healthy at every meal, or even healthier at every meal. Sometimes we're in certain situations and what is available to us might not be our heart healthy ideal, but we can make it better. You can make it healthier. We can make substitutions. So at every meal, you do want to make sure that you are incorporating a healthy component to your meal. Say, for example, you find yourself in going out to dinner with friends and everyone's getting hamburgers, burgers, and fries. Maybe there's a healthier option on the menu. There's either a grass-fed option, there's a turkey burger, a chicken burger. You could wrap it in a lettuce wrap, a whole wheat bun. You could skip the fries and get a side salad. So you always want to think about what's not just presented to you immediately, but what can you do to make your meal healthier? And what can you substitute? And I tell my patients all the time, no one's a machine, no one's a robot. Life is meant to be enjoyed and food is meant to be enjoyed. If it's your birthday, you eat birthday cake. You have to live and you have to enjoy. So if you are majority of your time, the routine of how you eat and live, do make healthy food choices. You incorporate good foods, good quality ingredients. You do have opportunity to indulge or have something that might not be on your regular basis, but that's the point. You don't want the unhealthy foods to become a regular basis. They should be an indulgence and a treat once in a while. And then you live guilt-free as well.
And what stands out about that response is, almost like what Dr. Rosen said, is about that intentionality, right? You're making that choice. And I kind of relate it to being a little bit frugal in some instances so that you can be generous. So you may stay away from some of the unhealthy things. So when it is time to celebrate, maybe to be around friends and family, you can indulge and enjoy the moment. And hopefully that created a little bit of a segue, because week 4 is all about building your team and really creating that support network, that as we're starting to make this momentum towards a healthier heart, we're having the people around us who are going to make that possible and sustainable.
The value of partnerships is really important. We speak about it throughout the book, that you can't do this alone, especially when it comes to sustainability. The most important first point is that you are the captain of this team, so that the team has to be created around you so that it works for you. It doesn't matter if someone said, oh, they're the best doctor or this is the best nutritionist. You need to find the team that fits your needs to be value added over a lifetime. So I'd say the first member of you that you pick as the captain is your primary care clinician, whether it's a gynecologist, a family medicine doctor, a nurse practitioner, an internist, somebody who is really your guide, the person you're really holding hands with. You want them to be someone who can develop a lifelong relationship with for prevention strategies, someone whom you trust, someone who understands not just your medical condition or your organs, but you as a holistic person, your needs in your family, in your social life, in your work life. Then, depending on your personal medical issues, your family history, you may pick other members of your team to include cardiologists, endocrinologists, gynecologists, registered dietitians, behavioral health professionals, sports medicine doctors. You think of all of the other professionals around your team. And then finally, we know that this works better with friends and family. You're going on this journey with the people who you love and the people who love you, and you're going to be better able to, celebrate the wins and, manage the losses. As Marissa said, we're not machines. So there's days that we don't do well, and the family and the friends say, tomorrow's another day, and keep the optimism and the empowerment going. So that's your team.
Oftentimes when you build a team, you also build in that accountability, right? Whether it's the doctor that you're going to see throughout the year, or the family member who is going to give you, a friend or family member who's going to give you that, send you that text message or call to say, hey, are we still going for the walk this evening? I love it. But you did mention, as part of building that team, potentially a registered dietitian or a nutritionist. So Marissa, that's your specialty. So what role does a registered dietitian or nutritionist play on this heart health team?
So what have we been talking about, this entire conversation? Food, what we're choosing to eat. And Diego, you said it very well. Every time we sit down to eat, it's a choice. We're making a choice. So you really do want to find a registered dietitian that you feel comfortable with, that you click with, because what a dietitian can do for you is help you look at your lifestyle, help you look at what's possible for you, not what's best always, because maybe what's ideal, maybe I can't pull off, but what can you as an individual do on not just today or tomorrow, but routinely, because we're talking about building lifestyle changes, habit changes. And a registered dietitian can help you, maybe think outside your box a little bit, because we all get in food ruts. We all get, oh, what's for dinner tonight? We all get stuck in these little grooves of the same thing all the time. And so a dietitian can not only help you understand what are good, healthy choices to make, that's certainly an important aspect of this, but different methods of how to cook, how to prepare, how to eat healthier on the go, because that too is a reality. We don't want to do it all the time, but we're all stuck in that situation. And what can you do on a routine, regular basis to make your food choices and your lifestyle healthier?
I really enjoyed what you said around someone who's going to kind of teach you some new ways to, let's say, prepare meals, but even kind of push you a little bit out of your comfort zone, right? Because that's what a good teammate's going to do. They're going to push you to be the best version of yourself, but also support you if you aren't perfect. Because none of us are. You said it earlier, we're not robots. As we're transitioning from week 4 to week 5, we're going to focus on the mind-heart connection. Maybe this is an important time to talk about stress, feeling down, kind of maybe being pushed out of our comfort zone. I know that this is a difficult time. We're a couple of years into a pandemic. What are the warning signs of too much stress?
The world we're living in is a time that question becomes more and more important. And, it's interesting. When our CATS Northwell Women's Heart Program was first initiated years ago, the two important positions outside of our physicians and nurses that our team felt was critical was an RD and a behavioral health professional, because we know the importance And those were two team members that were not always part of traditional cardiology programs. And we knew how critical that was. And, we all sort of start the stress discussion with, well, life is stressful. There's nothing I can do. And the truth is, there is a lot you can do, because your response to external stressors is what you can control and what can be modified, even by turning a thermostat down a little bit. And we know that there are chronic stressors and acute stressors, and there's things that we can do to acknowledge them, know what it's feeling internally, what our signs and symptoms are, and then manage them. So people have the negative feelings of stress in different ways. For some people, it can be a headache, it can be muscle aches, back pain, stiffness, it can be chest pain or pressure or sticking in the chest, it can be a racing heart. For some people, it's too much sleep, too little sleep, too much eating, a lack of appetite, anxiety, irritability. So each of us sort of feels the internal feelings of undue stress or unmanaged stress differently. But they are warning signs for us, because chronically feeling this way is not good for our heart and brain health. Behavioral health challenges and medical conditions are no different than body body medical conditions. So anxiety, depression, racing thoughts is a medical condition, no different than coronary heart disease is, or diabetes, or high blood pressure. So the idea in the past that there was stigma or no choice, or I should be strong and not tell anyone about these concerns or symptoms, is going away, but needs to go away faster. And your clinicians, public service opportunities, there are 1-800 numbers for behavioral health interventions.
Thank you, Doctor, for allowing us to highlight that really important topic. What I liked about this portion of your book is that there are many ways for us to practice mindfulness and to address the mind-heart connection. One of those being to address things like sleep and making sure that we're getting restful sleep. So Marissa, what are things we should avoid that might prevent us from achieving restful sleep?
Right, and thank you for bringing this up. It's an important point up, Diego. Sleep, good, adequate sleep is at the cornerstone of good health. So many times, even, when I have patients that are coming to me for weight management issues, one of the first questions I ask is, how much sleep are you getting every night? Because if you don't get adequate sleep, it's really hard to have everything else fall into place. When you're overtired, if you're really tired, think about, for anyone that's a parent, if you could think back to when you have a newborn, when you have all those sleepless nights, how hard is it to actually make a healthy food choice? Really hard, because you're exhausted and that's not your first priority. So when we're talking about good sleep, you want to think about, what are your routines? What are you doing? Some things most people do realize or think about, if they have caffeine too close to bed, that's something we want to look at, not having caffeine within a few hours of bed. And some of us are more sensitive than others. I have patients that can't have any caffeine 5 hours before bed. They're highly sensitive to it. Alcohol, chocolate has caffeine. Medications, herbal supplements, what types of pills are you taking, vitamins, before bedtime, and think about, what is potentially interfering with a good night's sleep. And there's something else that's really important that a lot of people do and overlook. Are you looking at your devices right before bed? Your cell phone, are you sending a text message? Are you sending, I got to get 3 work emails out really quick before I go to bed? And not only is your mind now focused elsewhere, you're thinking about work, you're thinking about doing something, but that blue light can really interfere with a really restful night's sleep. So what we really want to think about is a new bedtime routine, something that's for you, something that's calming, something that's relaxing. Put the cell phones away, put the laptops away, even turn the TV off, right? read a book, do something that's calming and relaxing, just to lay in bed and really get in that Zen kind of a relaxation period before you are actually going to nod off and go to sleep. So think about all of those factors. It's not always just what you eat, but it could be what you do and what you're thinking about before your head hits that pillow.
Yeah, I like that. And, you know, I was kind of laughing as you were sharing that, because especially around the caffeine, because thinking of my grandmother, she's Colombian, and obviously coffee is a big part of Colombian culture. And she has to have coffee with a little bit of milk before bed. So I guess some people are different. She says she needs her little café con leche before she goes to bed. But I know I can't have coffee after noon, because if not, I'll be up all night. But most importantly, I think that intentionality, again, of making those choices. You're saying it's time for bed. Turn off the devices, turn off the TV.
We call that sleep hygiene in the book, what Marissa's described. Even conversations about sleeping in nicer night clothing, you know, not sleeping in your sweatpants that you also work out in, or making, you know, your preparation for bed something that's relaxing and enjoyable.
I couldn't agree more. Putting yourself really into that proper sleep mindset and practicing good sleep hygiene. Well, as we're working our way through the 6 weeks, you know, we've talked about nutrition, we've talked about movement, we've talked about building the team that's going to help us achieve our mission. We've talked about working through some of the issues we may have to connect our minds and our heart. But now, as we reach the end of the 6 weeks, it's so important to now look towards the long-term goals. How do we make the habits stick? So Dr. Rosen and Marissa, I'd love to hear from both of you. You know, how do we turn these tips into long-term lifestyle changes?
Marissa?
So thank you, Dr. Rosen. So we'll start by saying, this is not just 6 weeks. This is a 6-week program, but we want to do this for the long run. This is our new healthy lifestyle. And look, we all say the saying, Rome wasn't built overnight, and neither is your new healthy lifestyle. So take one thing at a time, tackle it, do it well, do it repetitiously, so you have new healthy habits and you build upon them. Pick the most exciting thing to you, the most important thing to you, and start there and start to build this new routine, this new healthy habit, and build upon it and build upon it and build upon it and build upon it. So you are no longer, you're the former self that you were. You have all these new healthy lifestyles of not just what the foods that you're eating, but your sleep, you know, your routines, your movement, everything is incorporated into building this new healthy lifestyle, because we don't want it to be temporary. We want it to be long-term new processes for you.
Yeah, no, I agree wholeheartedly. I tell my patients that you want to set yourself up for success. You know, in other words, find something that is specific. Not, I'm going to lose 20 pounds in a month, because that's just setting yourself up to fail. One thing, I know that when the bread basket comes or there's bread in front of me, my brain turns off with regard to smart eating. So for the next month, I'm going to tell the waiter or tell my family no bread basket at the table. And I'm going to do that for 4 weeks, 6 weeks, till it just becomes part of me. And then I'm going to celebrate that. And then, as Marissa said, I'm going to choose something else. It's going to be specific. It's going to be achievable, because then I get to feel good about what I've done, the impact that I have on sticking to something, not just for 6 weeks, as you rightly said, but permanently. And then I choose the next specific, achievable, something to be proud of choice. And then I do that. I tell patients to either choose a food decision or a movement decision, and then pick a date that we're going to talk about it in 4 to 8 weeks to let me know how they're doing.
And I'll add to that too, Dr. Rosen. If today didn't go so well, it's not a failure. Tomorrow's a new fresh start. And think about, why didn't today go well? Not that you did something wrong, but what were your barriers? What were the obstacles? And what can you do differently the next day to help you achieve this? new goal that you have. And so tomorrow's always a fresh start.
I'm a big believer that, even the longest journeys start with that first step. And hopefully our audience who are listening today will be able to be inspired by your book and by your knowledge and the expertise that you've shared with us to begin their journey and take those first steps. I think in the spirit of including some audience participation, I'd love for you, if we can just take a few minutes to answer just a handful of questions from the audience. Is that okay with you?
Absolutely.
Yeah? Okay. So the first question, it comes from a new mom out on Long Island. And her question is this. She says, as a new mom, I think about nutrition a lot. What are some ways to help me make sure I'm giving my baby a good start?
Good question. I'll say enjoy the baby phase because you have control as a mom myself. But you want to always start with really good quality ingredients, quality foods for your baby. Introduce avocados, beans, fresh fruits, fresh vegetables, and make these healthy foods visually appealing to your children. And then when they get older, you have toddlers or even older children, make them part of your food decision process. Of take them food shopping with you, let them pick out some new things that maybe they want to try at home, let them help you cook, let them help you prepare things, so they're excited to see their creation and they're getting involved in this food process and preparing a meal. So it's never ever too late to start, and it's never too early to start either. So that was a really, really inspiring, great question.
Yeah, and I love your response too, because I think it's in line with so many of the themes that we've touched today. So let's go into our second question. Dr. Rosen, maybe you can answer this one. So during the pandemic, I stopped a lot of my healthy habits, my healthy routines. What are some ways to get back into them and get moving again?
No, it's a great question. It's the world we're living with. I think my first answer would focus on it's okay. In other words, similar to what Marissa said about tomorrow's another day, accept that we are living in unprecedented times and there are challenges for all of us. So it's okay to not be the robot, be the perfect, heart healthy warrior. And then, as we discussed, pick one thing, pick something important to you, relevant, specific, measurable, and decide that you're going to do a little more of that. It could be walking up and down the flights of stairs in your home for 10 minutes. It could be dancing with your family or children. Anything that you will feel empowered and optimistic about should be the thing you choose. And little by little, you'll start laying each of those new good habits on top of each other. But I think the most important point is, it's okay. Give yourself some grace in the, challenging world that we're living in, and pick one thing to start.
I love that response. Thank you so much. Okay, so I think we have time for just about one or two more questions. This next question comes from the Women Heart Support Group, and it has to do, I think, with the mind-heart connection. We hear about broken heart syndrome. Is broken heart syndrome real?
Yes, it's interesting. That is the colloquial term for it, but the medical term is Takotsubo's myocarditis, cardiomyopathy. And it is a condition that is seen far more common in women. And it is an acute form of heart disease that happens in the setting of either a very negative or a very positive stress. And we're not sure why it's more common in women. It's something sort of interesting that a lot of study has gone into. It is usually temporary, where there will be chest pain or other sensations. There will not be blockages. There will not be acute types of heart failure. It's a very specific appearance on an imaging test of the heart, an echocardiogram or an ultrasound. And for the vast, vast, vast majority of individuals, it resolves completely.
Well, I think the last question that I want to ask that also comes from the Women Women Heart Support Group is one that is so important because high blood pressure or hypertension is such an important issue. And it impacts so much of what we do, and it's preventable for the most part. So Dr. Rosen, why don't you tell us, what do your blood pressure numbers mean? And Marissa, maybe you can then tell us a little bit about what are some ways that we can bring down or improve our high blood pressure through diet.
I would say that after cigarette smoking, tobacco use, managing high blood pressure and hypertension is probably the most important preventable opportunity we have. So we talk about number over number, right? So the top number is called our systolic blood pressure. And ideally, you want yours to be less than 120 millimeters of mercury. And that is the pressure at which the heart is pumping. The lower number is called the diastolic blood pressure. And ideally, we'd like our diastolic blood pressure to be less than 80 millimeters of mercury. And that's the pressure that the heart and blood vessels feel when your heart is relaxing.
So from a nutrition perspective, from a diet perspective, what can you do to help control your blood pressure is a very important question, because we do have some control here. Reading food labels, looking to see how much sodium is in the products that we are actually selecting. And it's not always the apparent thing. Certainly there's plenty of those things that are cured, or things are overtly very salty. But you also want to look at other products that you're routinely choosing, and like bread products, your crackers. Really what we talk about in this book is really being a smart, savvy shopper and being informed. And to do that, you have to read the food labels. You need to read your nutrition facts label, especially for sodium, and making simple swaps like we talk about, of avoiding highly processed foods, making more foods from scratch at home, using more natural ingredients, and even looking at excessive intakes of caffeine can affect blood pressure. So how much caffeine are you having really on a daily basis? So blood pressure and how much sodium you are consuming on a regular basis is a direct correlation, and you do have opportunity. Everyone has opportunity to help lower their sodium intake. And reading those food labels, I can't stress it enough, because there's a lot of hidden sodium in foods you do not necessarily taste salty to the tongue. So you just want to be a smart, savvy shopper, and we do give you those tips on how to do that in the book.
Well, on behalf of our community, I just want to say thank you. It's been my pleasure to welcome our two distinguished guests for Northwell Health, Dr. Stacey Rosen and registered dietitian Marissa Licata, who are co-authors of a new book about women's heart health titled Heart Smarter for Women, 6 Weeks to a Healthier Heart. I mean, there's so many important messages here of intentionality, accountability, determination. So we're always grateful when we're able to speak with you and learn from you. So on behalf of myself, Dr. Rosen, Marissa Licata, everyone at the American Heart Association and Northwell Health, we're wishing you a healthy summer. Thank you all, and take care.